Good afternoon everyone. We are from second year class and today we are going to explain MTP topic, which is a group presentation which is guided by Dr. Siraj Khan sir, myself Nazia Sheikh, she is Aarti Governor, and herself Madiha Nuri, and last one is Susan Iftikhar Ali. And now we are going to proceed our topic MTP Act, which is going to present by Aarti Governor.
IMP Act is also known as induced abortion. It was brought into force on 1st April 1972. This Act provides following grounds for termination of pregnancy: therapeutic ground, eugenic ground, humanitarian ground, and social ground. Therapeutic ground, this relates to the condition where continuity of pregnancy would involve risk to the life of pregnant women or grave injury to her physical or mental health. The condition includes organic heart disease with failure, hypertension, nephrotic syndrome, pulmonary hypertension, uterine hemorrhages or infected uterus. Eugenic ground. This includes conditions where there is substantial risk that the child, if born, is likely to suffer from such physical or mental abnormalities. This condition includes German measles, smallpox, chickenpox, viral hepatitis. Exposure to X-ray and other radiation when the pregnant woman has received cytotoxic drugs. Humanitarian grounds. This includes those cases where pregnancy has been caused by rape. According to WHO, health is not merely absence of disease but positive state of all our physical, mental and social well-being. Thus, wherein pregnancy is alleged by pregnant women to have been caused by rape, the anguish caused by such pregnancy is presumed to constitute grave injury to her mental health. Social ground. These relate to conditions where pregnancy in a married woman is the result of contraceptive failure. And second, the environment of pregnant woman. No contraceptive is 100% effective. Therefore, where any pregnancy occurs as a result of failure of any device or method used by any married woman on her husband for the purpose of limiting the number of children, the anguish caused by such unwanted pregnancy is presumed to constitute a grave injury to mental health of a pregnant woman. Pregnancy can also be terminated on environmental ground. For example, if the woman has some heart disease, the strain of rearing a child is likely to be too much for her. If new arrival is likely to create financial difficulties leading the family to poverty line. If the woman has already 2 children, she is doing all her work by herself and lives in a single room where she cooks the family. Now I will call Susan to explain the rules for MTP Act.
I am going to explain the rule for the MTP Act first. A qualified RMP who has assisted in performance of the 25 cases of MTP can terminate the pregnancy. The private hospital have to obtain license from the Chief Medical Officer of district, and the consent of the woman or her guardian is required. In a case of minor or an innocent person, consent of the husband is not necessary. The abortion cannot be performed on a request if the woman is not willing. A woman need not produce the proof of her age. Her statement that she is about 18 years is accepted. It is enough for the woman to state that she was raped, and the professional secrecy has to be maintained here. The MTP should be done in a government hospital or a licensed private hospital. If a period of a pregnancy is below the 12 week, it can be terminated by a single doctor, or if it is below the 20 week, then the 2 doctors are must concur, and then there is an indication letter. Any one doctor can terminate the pregnancy. And if there is an emergency condition, then the MTP can be done by only a single doctor, even without required training, and even after 20 weeks, and in a private hospital which is not recognized. We continue with the experience and training of a doctor for the MTP Act.
Now I am going to explain the experience and training of a doctor in a MTP Act. The Act describes the registered medical practitioner as one who possesses any recognized medical qualification as defined in clause of Section 2 of Medical Council Act in 1956, whose name has been entered in a state medical register and who has experience or training in gynecology and obstetric as may be prescribed by rules made under this Act. In up to 12 weeks of gestation, if he has assisted a registered medical practitioner in performing 25 cases of medical termination of pregnancy, of which at least 5 has been performed independently in a hospital which is established or maintained or a training institute approved for this purpose by the government. Up to the 20 week of gestation, the medical practitioner who has registered in a state medical register immediately before the commencement of the Act, having the experience in the practice of gynecology and obstetric for a period of not less than 3 years. In case of medical practitioner who hold a postgraduate degree or diploma in gynecology and obstetric, the experience or training gained during the course of such degree or diploma. Then in the place for MTP, the Act always laid out a certain requirement in respect of place where the MTP can be performed. It can be performed in government or quasi-government hospital, MTP centers approved by the governments. Certificate of approval by the government must be conspicuously displayed at such approved centers. Then the role of consent. The entire scheme of the Act shows that the provision thereof can be invoked only by the pregnant woman. An adult woman 18 years or above can give a valid consent. However, in case of minor below 18 years or a mentally ill woman, consent of a guardian must be obtained. It is a doctor's responsibility to ensure the age of the patient and to take her guardian's consent if she is a minor. A doctor got into trouble when a minor girl claimed herself to be a major and signed the consent form. Her spouse consent is not required, and however, it is wise to get either husband or any other person's signature as a witness to be women's consent. Next, I will call Nasia to explain method of inducing abortion under the MTP Act.
Now I am going to explain the last topic of MTP, that is method of inducing abortion under the MTP Act, in which during the first trimester we see two methods. Is it a medical method and surgical method? Under medical method we see that presently include the use of the following drug, that is prostaglandins, that is prostaglandin E1 and prostaglandin E2 alpha are quite effective, that bring about uterine contraction and expel the fetus. And the next drug is antiprogesterones, are the compound that inhibit the action of progesterone at the receptor site. And the next method is surgical method, which include two types of surgical procedure, namely vacuum aspiration and dilatation and evacuation, that is also called dilatation and curettage. And next is during the second trimester we also have two methods, that is medical method and surgical method. Under medical method presently being used these days are one or the other form and one in various combination of intrauterine in instillation, PF hypertonic saline, that is 20% NaCl or urea or ravenol, and prostaglandins by various routes, that is several factors seems to be involved are liberation of prostaglandins from degenerated decidua and fetal tissues, and next is change in electrolyte balance of the amniotic fluid, and the third is overdistension of the uterus owing to drawing of fluid by the hypertonic solution. And the next method is surgical method, which include the dilatation and evacuation as it is mentioned in the first trimester of surgical method. And next is hysterectomy and the third one is hysterectomy. Thank you.